Sorry, I had an email there that kind of threw me off midstream there. But radiculopathy, radicular pain. So again, active range of motion exercises can be very beneficial. So essentially, motions that either centralize the symptoms or diminish the intensity of the symptoms can be helpful in repetition. So for example, if we get peripheralization of symptoms with repeated extension, repeated flexion exercises centralize the symptoms. We might want to give exercises that really focus on flexion-based active range of motion to try to centralize those symptoms. Neural mobilizations can be beneficial. So we talked about nerve mobilizations and musculoskeletal one, and we won't go through all the mechanisms again because I know we went over that pretty extensively, but just remember that we could do nerve mobilizations actively and passively as well. And the same concepts apply when we're talking about the lower half of the body here. But that being said, we're moving the body progressively through different motions with the lower extremities rather than the upper extremities. Now, a progressive stabilization program can be helpful for these folks as well. Again, trying to provide stability to anywhere that's unstable if that is related to the patient's radicular pain. Lumbar stenosis, really we want to take into account whether we're dealing with a central stenosis, that central canal, versus a lateral canal stenosis. So we might have different intervention approaches based on what's going on with the patient. So activity modification can be important with this population, especially trying to change those activities that are increasing the patient's symptoms such that they can still be functional without having as much limitation. Our joint mobilizations as well. So remember, as we talked about musculoskeletal one, sustained hold manipulations. So they're those where we get in a position and we're stretching for 25 to 30 seconds might be the way we want to go if we're talking about hypomobility. So remember our collagen stress strain curve, we have to have a certain amount of strain for a certain amount of, a certain amount of stress for a certain amount of time to cause tissue elongation. So doing an oscillation at beginning or mid-range, we might not get a change in mobility or extensibility of those stabilizing structures. However, oscillations still have a role to function with our folks who have stenosis, and that they can help with pain reduction. Muscle performance, training endurance and coordination and strength of stabilizing structures for the spine. And also new literature, I say new literature, but it's been coming out for quite some time now. Strategies involving the body weight supported treadmill system have been shown to be beneficial. So essentially, if the patient has limitations with being able to walk for longer periods of time, the body weight supported treadmill system might help them get in a better position such that they're not having as much crowding essentially at the spine, but still allow them to get the benefits of walking as well. Zygapophyseal arthropathy, it's important to consider whether we're talking about a chronic degenerative type presentation or an acute type presentation. If we're talking about a acute presentation, we're going to want to think about general acute management strategies. So if we're still in that inflammatory stage, not wanting to be too aggressive with the area there. If we're talking about a subacute phase, essentially that might be a great time to do a manipulation procedure or joint mobilizations. So also addressing muscle guarding can be pretty important. So that can be done either with joint mobilizations or with soft tissue mobilization potentially, which can also aid with pain modulation as well. And paraspinal coordination training. So if we're talking about an acute type presentation, we may or may not focus on this. Really, that comes down to testing, whether or not we identify that as an impairment. However, if we're talking about a chronic situation, we might be more likely to go into our coordination training and take that into functional training as well, especially if we find that impairment. So lower intensity, high frequency and duration exercises can be really helpful as we're talking about uh, uh, essentially facilitating joint nutrition and also modulating pain through stimulation of mechanoreceptors. And our or our manual therapy interventions, we might be more likely to work on sustained hold mobilizations. So those stretch type mobilizations, if we're talking about hypermobility, which we would be more likely to find in a chronic situation, versus say uh, our oscillations in a beginning and mid-range, which we might be more likely in a more acute, more irritable type situation. Also, manipulations to address that pain and muscle guarding. So, can really be used with either population, might be a little bit more beneficial with our acute, more specifically our subacute type population.